Hi. So if you're somebody who is scared of Botox and filler, you're amongst a lot of people who are ideally scared. Let us discuss some facts. Well, if you're going for a treatment as easy as Botox, Botox is just a Clostridium bacteria which is already present in our body. It is the excretion of that bacteria and it is completely safe. Botulinum toxin is the name of the drug. Botox is the name of a company. It's something like Louis Vuitton or Gucci. It's a brand. So Botox is the name of a brand, and we have a lot of companies who's making botulinum toxin, out of which 2 or 3 companies have got their US FDA approvals. Botox is a company which got its FDA approval the first because it started its drug in 1980s itself. Well, Botox is extremely safe, but only and only if done with trained professional, and also the trained professional is spending time and explaining you the post-care, because there is a lot of post-care involved when you're going in for a treatment like Botox or fillers, basically the anti-aging treatments. So when you're going for a treatment as simple as Botox, which is called as office procedure, it's a lunchtime procedure. You just walk in, do your Botox, walk out. It's that easy. So if you're going in for a procedure like that, you should definitely know a few things. So your fact check would be, your doctor is a trained dermatologist or a plastic surgeon. He or she is trained to do Botox. That's very important to check, and very important that the doctor is opening a new vial right in front of you. It has the US FDA approval seal, it has another seal, and when the drug is opened, it is vacuum packed. It's beautiful. It is vacuum packed. So when the doctor puts the injection, it automatically fills up the drug in the syringe. So these are few fact checks which you can do, because if none of them are maintained, you can have serious side effects. Most importantly, when you go in for Botox, it's hardly any pain. It's like a small mosquito bite, something what we get in our garden all the time. So it should not be painful. There is no drop of blood which is released because it is a subcutaneous injection. Botox mainly works for upper face. Yes, Botox will only work on the upper face. This is the area which works with Botox. This is the area which works with fillers. This is the area which works with fillers and threads. Botox also works very well for platysmal bands to give you the right jaw. So if you want a jaw like Priyanka Chopra, like Ranbir Kapoor, like Barack Obama, a nice square jaw, nice sculpting on your face, chisel face, and you've been doing it at the gym and not been able to achieve your desired results, yes, you can pump in a little Botox and that will definitely be an add-on. Make sure that you do all the fact checks. And lastly, coming on the post-care. Post-care, post-Botox is very simple, that for first 6 hours, no rigorous exercise, no bumps, no dhakka-bazi, have a very simple, luxurious kind of life. If something falls, you just pick it up very gently. You don't bend your head, because there should not be pressure change. There should not be a flight for first 12 hours preferably, because we don't want pressure change in the muscles so that the Botox doesn't seep in. The side effects most commonly with Botox is wrong injection into the muscle, bacterial infections, tuberculosis. It can also lead to ptosis, the drop of lid we have seen very commonly with a lot of VIPs and celebrities, which has been covered in media. When Botox goes wrong, a lid can just drop, but that's temporary and it will only last for 3 months. Same way we have seen drops in the mentolabial, the laughter, the sad lines. If you do some Botox here and the doctor hasn't injected well, or you haven't followed the post-care, it can fall again. But these results are temporary and they last only for 3 months. Ensure you're going to a very trained professional and not getting yourself injected just anywhere, because currently, very unfortunately, in India, there are a lot of quacks which have sprouted up, and there are a lot of places who are doing lasers and such treatments without any kind of legal licenses. Well, this is about Botox and fillers. Fillers is something I truly love. Filler is something I think very important for us ladies especially, and yes, of course, men. Well, men are not behind in the race today to look good. Trust me on that. I have lots and lots of male patients, and filler is something which can make you look younger at any age. Yes, at 50 you want to look 40, you can do it. At 60 you want to look 40, no. If you haven't maintained it, if you haven't done your filler over the years, you just cannot suddenly decide at 60 that you want to look much younger. Filler is just a simple sugar molecule, you can understand in layman terms, which is already present in our body when we are born, and it keeps getting degraded, it keeps getting degraded and gets lost in the body, in the system. So all it is just a hyaluronic acid, which is a molecule which is normally present in our body, like how in between a building you see bricks. being attached with cement. Hyaluronic acid is that material in our body. So we need a lot of it, and pumping yourself with fillers, again with a trained professional with a fact check, is going to be good. There are several companies which are US FDA approved. Please try and make sure, do your Google and fact check and go only for those companies. Go to trained professionals. It's a lovely treatment. It can go wrong if not done with a good trained professional. You can even go blind, you can lose a muscle, you can develop a big scar, one can develop tuberculosis. It can be really dangerous. Sadly, there have been few cases of death also secondary to fillers. So you have to be with the trained professional. I've been doing it for last 11 years for thousands of patients, and touch wood, it's been fantastic experience, because as a doctor it is extremely satisfying when I see the great results. Lastly, you must know how fillers and Botox was invented. Interestingly, fillers came up when people with HIV increased. It is in 80s that we started to take out fat. Certain doctors abroad who took out fat and injected in the face, because sudden lipoatrophy, and you could just understand in a crowd that this person could be spotted and could have HIV. So that is how fillers were invented, and it's been a rampage globally. It's only the commercial quacks who have spoiled the reputation of such easy treatments, which we shouldn't fall prey to. Please ask us questions below. Please give your comments. Please give me suggestions, what you would like to hear from me, what kind of fact checks you're looking, and I would love to answer them here in my print opinion.